To Conceive. Believe it or not, more babies are conceived during the holiday season than any other time of the year, and people are now able to learn more and share more about their pregnancies than ever before. If you are one of the many would-be moms hoping to get pregnant this season, there are a few steps you should take to help ensure a healthy pregnancy. And here to tell us what those are is Dr. Jill Heckman. Good morning, Dr. Jill.
Good morning. Thanks for having me.
Happy to have you on this morning. And this is so interesting that this really is a busy time where families want to expand their families, right? A lot of people thinking about this.
Conception rates are at their highest during the months of November and December. It's cold outside, so people are staying inside.
They are. So tell me, what do you think us, women need to consider and need to know? Because, I know I was there, a couple of years ago when you're wanting to start that family, and sometimes it seems all-consuming. But what do you think people need to, really take to heart and remember when they are trying to start a family?
Well, for one, I recommend starting prenatal vitamins as early as possible. Having those on board to build up your stores, such as iron and folic acid ahead of time, can really help protect your pregnancy. The second thing is talking to your primary care physician about any medical problems you may have, like high blood pressure, diabetes, obesity, making sure those are in check prior to getting pregnancy. And then the one thing I recommend that people don't commonly think about is having genetic carrier screening tests done. And that test to see if the mother's at risk of passing on a genetic condition to their baby.
Very interesting. Talk about age too. At what ages should we be looking at? And, anything we should know as I know women get older and if they're still trying to conceive?
Well, women are tending to wait a little bit longer. Careers are coming first. And so when you wait till you're over 35, you are more at risk of passing on Down syndrome to your baby. But there's new testing available called the Panorama, which is a non-invasive prenatal test that you can have done as early as 9 weeks to see if your baby is low risk or high risk of having Down syndrome or other genetic conditions.
What are the benefits, do you think, of finding that out early and finding that out during pregnancy?
Preparation and knowledge is key. One, it helps you prepare. Two, it helps the doctor prepare and manage the pregnancy a little bit differently. And of course, make sure that you're at the right facility with the right people taking care of your baby so their entrance into the world can be as safe as possible.
All right. Well, Dr. Jill, what's your take home? As maybe we have some people watching this morning and want to, again, expand their family. What's your take home? What do you think they need to remember this time of year?
To go ahead and speak with your physician and be as best prepared as you can be so that you can have a safe and healthy pregnancy.
Yep, that's what we all want.
Counts.
All right, Dr. Jill, thank you so much.
Yes.